Okay, so I'm gonna try this again, and please overlook my horribleness this morning. I woke up and I'm pretty sure that I've developed an infection in this eye that I caught from my son. And I'm just still tired and wore out. I wanted to talk about this place called the Well Key Clinic in Knoxville. They have an office in Sevierville too. Some of you already know, some of you don't know. Both of my kids have pretty bad allergies and asthma. My daughter isn't as bad as my son. My son has several food allergies, a lot of environmental allergies. He takes 2 shots a visit once to twice a week. He's been doing this for over a year now, and he has really bad asthma. He takes 2 asthma control medications along with his rescue inhaler, and he has to keep a nebulizer around because sometimes the inhaler is just not enough. On top of all the other medicine he's on. But, he still plays sports and all that stuff. Doctor, agreed with me that it's good for him. You need the exercise. You need to exercise your lungs if you have that issue. Well, okay, so Thursday, today's Tuesday, so it was last week, me and my husband were laying in bed. It was actually his birthday. We were just kind of chilling out, watching movies while the kids were gone to school. And the phone rang, and I noticed that it was one of the schools. And their numbers are so similar because they're not far from each other. I was like, which one do you think it is? And he said, I don't know. Well, when I answered the phone, and they said, oh, this is Nurse Amanda, I was like, oh, this is Aiden. I said, okay, what's going on? Which I knew Aiden was congested that morning, but he seemed okay. He didn't have a fever or anything, so I sent him on to school figuring it was just allergies because ever since the fires in Gallenberg, everybody here has been, well, me and my kids have been having issues with our allergies and asthma. So I sent him on to school, and now Aiden, everybody knows Aiden's not one to complain. He doesn't complain about getting hurt. He doesn't complain about not feeling good. If he doesn't feel good, most of the time, he just kind of goes to sleep. Or, he just goes and lays down. She called and she told me, she said, Aiden's here in the office. He's not feeling well, and he's really congested, but he doesn't have a fever. So I said, okay, well, if he's come to you complaining, then he's obviously really not feeling well. So I had my husband go get him and bring him home, and I told him to lay down for a little bit, and then later, because it was Thursdays usually when we go to the shot clinic. So the deal with them is they can still take their shots as long as they're not running a fever over 101.1. They've not had a rescue medication used in the last 24 hours. And if they're on antibiotics, it has to be at least 48 hours after they start it before they can have their shot. So at this point, he's still going to go for a shot. When he wakes up, he has a fever. It's a low-grade fever, very mild. Was still able to go to the shot clinic, but he was so congested that I called the doctor and talked to them, and where Katie doesn't really have a reaction when she gets her shots, Aiden always does. Without fail, either like just normal allergy stuff or like local reactions or both. The doctor was saying that since he was already so congested that they didn't feel like that we needed to try to push it, so we didn't go and we stayed home. And since he was running a fever, he didn't go to didn't go to school next day because the rule is I had to be fever free for 24 hours. I went ahead and called the doctor the next day, and they weren't going to be in but like half a day, and they couldn't get us in, so they spoke to me, and they were very adamant about the fact that I take him to a walk-in clinic and not the emergency room, because his body can't handle the flu, not with his breathing issues, and since he's allergic to eggs, he can't have a flu shot. And I know some people think that it's okay to give them under a doctor, and that's true in a lot of cases, almost all of them. But if you or your child, one, has had a reaction to the flu because of your allergies, it's kind of left up to your doctor. And I've asked his doctor 3 times, his specialist, not his pediatrician, 3 times, do you want to go ahead and give him a flu shot? And he said no, because of the reaction he's had before. So what we do is everybody else gets the shot, so we can try to keep it out of the house. So then the only exposure that he can really have to it is like at school, or if he goes over to a friend's house, which he doesn't really go a whole lot because of his food allergies. Some people are just a little intimidated by it. There's a few that get it and don't mind. And, of course, some people, too, get a little intimidated when you hand them, a bag full of medicine because he's on, like, 5 and an EpiPen. So I get it. I understand, and if he goes and stays the night with somebody, I always send, like, almond milk for him. Anything that I can find that he might need that they wouldn't necessarily have in their house if they don't have somebody that's got food allergies, too. And then, Aiden pretty much knows what he can and can't have. And if he's unsure, he does know how to read a label. And if he's still unsure, he will ask an adult. So, he's at the age that he can kind of control that himself. Anyway, so I was going to try to take him to the walk-in clinic that we usually always use, but they didn't have any appointments open, and it said walk-in only. And the last time that we tried to do that, it turned out to be a nightmare because we went down there and they were booked, and we came back when they told us to, and they were closed. So that day, my husband took him to Wellkey. Said some of the guys at his work had used it and, enjoyed the services they got there. I mean, liked how they were treated there, whatever. So we took Aiden there that one day. And so I was like, well, I'll take him there today. Now, Aiden was seen by them in November. We just got something from the mail in him, like, the last week or so, stating that we owed $20. And I'm like, okay, that's not right, because I know how our insurance pays. Especially, when you use something other than a doctor's office. Having, I don't know if it's just because we have union benefits, but, and where they had to vote on a new contract. And I watched a video with my husband about the insurance changes, because, they were trying to give them points on whether they wanted to vote for it or against it. And so I have a full understanding about our health benefits. I'm still, I admit when it comes to like our dental, I don't have a full understanding. I do know most of the stuff that we have done is free. There's only a few things that we have to pay any kind of deductible, or not deductible, but like co-insurance or copay or whatever you want to call it. And see, with our insurance too, even specialists are just, it's the same as going to his regular doctor. We don't have to have referrals or anything. So I went to Wellkey, and we had never been able to get in touch with somebody over the billing department over the bill, because we knew that it was off. And sometimes it's easier to talk to the insurance company first. Sometimes you need to talk to the billing, find out what's going on their end, and then call the insurance company and tell them, and then kind of figure out what needs to be done, or if it's a mistake, or if it's not a mistake, what, pay it, because that's what we do. And if I use a place that knows that, the way that they file their insurance is not going to take, it's more than just my $10 deductible, and that it's going to be billed as like outpatient service, which is like hospital bills, the kids' allergy shots, their serum, stuff like that is all picked up by our insurance company at 80%. Now, we don't have a deductible, but we do have an out-of-pocket maximum of what we pay. So it's not a deductible, because what it's for is where we have in the plan where we pay 20% of certain bills. They once we hit that maximum, then they stop the 20% and it's free. Like, they cover everything. So he was seen at the early November, and I'm like, even though I didn't realize at the time that how they were billing, I knew that we had already met the out-of-pocket maximum. So when I went in there, when I left, I just took the bare essentials, what I needed, the copay, and left. And they were like, well, I checked them in online too, and no issues. And so when I got there, I tell him, I go, take all this time filling out the paperwork, turn it in, and they're like, okay, well, we need to get, we see that you have a balance here of 26 and some change. And I'm like, well, okay, first off, the bill that we got at home doesn't state that. We've been trying to get this taken care of, trying to talk to somebody, and it's led to dead ends. So, can you look at it since you're here and tell me why? Because I know that it's not right. They looked it up, and they said it was coinsurance. I'm like, there's nothing owed on that anymore, especially not from that point. I mean, we're already about halfway to our out-of-pocket maximum already this year, and we're just in January. So I called the insurance company. First off, those were two of the rudest women I have ever met working in the doctor's office at that front desk. One had no idea what they were doing. No clue. The other one, she didn't really know what she was doing either. So I talked to the insurance company. The insurance company pulls it up. And first thing they said was, for some reason, this has been billed as a outpatient procedure. If it's a walk-in clinic, then it should be billed as a doctor's visit. So I tell the girl, and she was like, well, we're considered urgent care. Okay. And the insurance company is like, well, their contract would have to be looked at if it's not in their contract that they bill for outpatient services rather than doctor's visits like most walk-in clinics do. Then they're not allowed to bill you as a outpatient service. And of course the guy was like, the people that would know that are out today, but they started doing some digging, because I was like, well, even if it was billed as an outpatient service, our out-of-pocket maximum was met by this point, so we don't owe the money. And he did some digging, and he came back and he was like, you're absolutely right, where the bill was not actually submitted till after the first of the year, when he was seen at the beginning of November. It just kind of glitched in the system, and said that we didn't have the out-of-pocket met, which it doesn't go by date of file, it goes by date of service, and by date of service we did. So he was like, no, this is not correct. And even they had a different number too. So I was given 3 different amounts owed from the insurance company, live there in the office, and then from the paper bill at home. And so I was like, okay. And I was talking to the lady, and they were like, well, let me talk to her. So I put her on the phone, and they tell her, looking back on this, even if it's billed as outpatient service, their out-of-pocket maximum was met, so they don't owe anything on this bill. We need you to refile, and it's been noted in the account, and then it'll be taken care of. And so she hands me back the phone, and we're going back and forth, and this insurance company put a supervisor on who spoke to her too, and said the exact same thing. This money's not owed. All it's going to take is a refile, and then it'll be paid for. And I asked her, I was like, if you guys are not a doctor's office, why are you taking a doctor's office copay? Because every other place that we go that bills us for outpatient services gives us an estimate of what is owed, and then we either pay half, or they bill us for it. Never been a problem. And of course, she had no idea. No clue. And the supervisor told me, said, ask for somebody in charge. Ask to speak to somebody in charge. So I asked, and she's like, there's nobody here. I'm like, you're meaning to tell me that a healthcare clinic is open and taking patients, and there is nobody here in charge? Like, most businesses, when they're open, almost every single business, when they're open, has somebody in charge. Some kind of supervisor or something. They claim there was no charge nurse, no office manager, no head doctor or whatever. They called another clinic, which is their other clinic in Spearville, which I'm taking it as like their main office, because they were speaking to somebody there. Well, they were like, okay, so go ahead, if you'll go ahead and pay this amount that we have in the computer, and then everything will be done Monday, and then when the insurance company takes care of that, then we'll cut you a check for a refund. And then you're still going to have to pay the $10 copay for today. Okay, for one, now I already know that I don't owe you for the doctor's office copay, that I owe you for 20% of the bill. Now, they have it down as that they charge like $75 for a cash patient. So you do the math at 20%, none of those bills make sense. And I took Aiden in, like, the reason why it was so adamant that he was seeing his eyes were swelling. The one had started the night before, and then the next day he woke up and they were swelling again. And the doctor was like, he could have gotten into something that irritated him, and if it's still bothering his system, it can actually cause delayed anaphylaxis, which I always just assume that it typically happens pretty much immediately, or at least within the first 30 minutes, because they always say the first 30 minutes is the really crucial time where that can really happen. Like, it's uncommon for it to happen afterwards. But with the swelling in his eyes and stuff, they were like, he needs to be seen. So I was like, okay, I didn't bring everything with me, and why should I have to pay more money for something that I told you I don't owe? The insurance company told you I don't owe, that there was a mistake. And they were just like, well, that's just how we do things. That's our policy. And I said, well, can you have somebody come around here and just look at him and make sure that he's okay to leave? That they don't think that it's a threat. Check his pulse ox or his blood pressure. Both would have been the smart thing to do. Oh, no, we can't do that. Okay, so my son could possibly be having some breathing issues. And you're going to refuse to see him over $26 that I don't have because I left the house in a hurry. It's not like if I'd have had it on me, I probably would have paid it, but I'm glad I didn't after I looked them up, looked up the reviews and actually read them. So ended up, we left and we went to another walk-in clinic, was in and out within a matter of like 15 minutes. It was no big deal. And great thing about that too is I know for a fact that I don't owe anything more than $10. So I got home and I started doing a review on this place. Apparently, when they first opened, they done business a lot different. And they seem to have been better. But as time has went on, the reviews start getting worse and worse and worse. And most of them are misdiagnosis that's ended up costing them thousands to get a proper diagnosis and proper treatment altogether, between paying them, getting the medication that was prescribed by them, and then having to get a second opinion and more medication they have to pay for. One case that I read that was a review was a cancer patient that was misdiagnosed. There was a lot of billing discrepancies where they were overcharging people, and when it was brought to their attention, they're like, okay, it's no big deal, we'll refund it. And people were like, it's been 3 months now and I've not gotten my money. And Wellkey replies with, oh, it's office policy that everything goes out within 30 days. I could see if it was just one, maybe, like them just being pissed off, but it was a bunch. And a lot of people complaining about how they were treated. But most of it was just misdiagnosis, like to the point where they didn't really check him. They just looked at him and give him a diagnosis. So it seems to me that somewhere in there, I know there was a change because Welke hasn't really been around that long. And I noticed that they did say they were the only level 1 urgent care clinic in the area. Apparently, they used to work as just a walk-in clinic, which is what they tell everybody to begin with. They don't tell people that they're urgent care. Yes, it's on some of their stuff, but it's very small. And a lot of people wouldn't think about it because a lot of walk-in clinics, say urgent care walk-in, and they still charge you as just a walk-in clinic. Well, they can't just charge you for, they can't bill you differently just because they want to. They have to have a contract. So the insurance company gave me like every place with the state that I needed to write a complaint, file a complaint with on them. And then I took care of that. And then I found out somebody that has the exact same insurance as us because the husband works with my husband, has used them and said that they only pay the $10 copay. Okay, I don't know if they've been there recently, but yeah, that tells me that there's been a change in billing, and I'm really curious to see if their contract has been updated to say that they can bill us for outpatient services, not a doctor's bill, or like not a doctor's office visit, which is stupid because, I mean, we pay $10 for specialists, and if they're considered a specialist, then we only owe them $10. The only time that we owe 20% of anything is if there's any kind of labs or anything that needs to be done. And then again, if it doesn't need to be done immediately, I can request that they write it out and go to the lab that we have insurance. We have like all these different little things with our insurance company. So we can go to a specific lab and get all of our lab work done for free. We can go to this imaging place, get all of our imaging done for free. So, there's really, the only time that we really have to pay the 20% before the out-of-pocket is met is when they file for payment for new serum for the kids' shots. When they administer the kids' shots, that's an outpatient service. And that's really it. And then hospitals, they're done the same way. It's 20% till out-of-pocket maximum's met. Then they're free too. So there's a lot of issues here, and some people, don't really understand. We have, everybody gets confused by when they ask me about my insurance and stuff. We don't have typical like health insurance, and just because we have health insurance with this one company doesn't mean that somebody else with the same insurance company is going to have the same policy as ours because we're under Teamsters. So that's been a big nightmare. And anybody that doesn't believe me, just look them up and look up their reviews. Yeah, there's some good ones out there, but they're mostly really old. All of the most recent ones are typically really bad. I'm really surprised they're still open. I'm surprised I've not been sued. I would not let them bathe my dog, much less, treat somebody medically ever again. And I would really, people that I care about, I wouldn't want them going down there. Oh, hell, I don't want anybody going down there, but I just want to let everybody know that this place, they're fraud. I mean, they're scamming people. I don't know if they're doing it intentionally, but something needs to change within the business so that it runs a bit smoother. And and more professional, because the two ladies that I dealt with at the desk were completely unprofessional. It was awful. I've never, ever, ever had a doctor's office or anything like that give me that much trouble when we've had a billing discrepancy. We all talk to the insurance company, and then they're like, okay, well then just pay this, just pay your copay, and then we'll take care of the rebilling and get this taken care of for you. It's no big deal. Never ever had this problem. And nobody in billing ever gets on the phone. Nobody's ever available. No supervisor's ever available. Nobody in charge is ever available. We've tried to call several times. So it seems to be kind of the common thing with them after looking at the reviews, that misdiagnosis. So I'm kind of glad that it worked out the way it did, because I trust where I took him in the end. And I don't really know, it'd have been awful if he would have went in there and they would have misdiagnosed him and sent him on with his health issues, because that could have been really bad. But of course, it's like I told him, if he was to go and start having some really bad issues, like if it's something in the air that's causing his eyes to swell, and then he was to have anaphylaxis, I've got an EpiPen, but could be stopped by, a doctor taking a look at him and checking him out. It could have, it could have been prevented, but they didn't care. All they cared about was their $26. More important than a 10-year-old and their breathing, I guess. Anyway, check them out. Look up the reviews. I don't normally do videos like this. I really like to try to stay positive, but this is just something that I feel like everybody needs to know. It needs to be warned about. But yeah, so if you don't believe me, just look up the reviews. I mean, they're all there, especially the ones on Facebook. There's some that's been deleted. You see people complaining about it, but just check them out, look them up. You'll see that they've changed, obviously, very recently, and have had a lot of people that are very unhappy about it. Hopefully I can have an update on what's going on, whether or not they were allowed to bill me the way they bill me, or if they weren't, or if anything happens with the complaints that I file. I'll try to update on that too. I just want them to start giving people better treatment and better service, because, having a kid with immune issues anyway, if he was to get diagnosed, that'd be awful. And I know he's not the only one out there like that. So I don't want, they could really hurt somebody with as far-fetched as some of their misdiagnoses have been. And, they've cost a lot of people a lot more money if they'd have just been diagnosed right the first time, which could have been, something as simple as a swab of the skin, to test, stuff like that. So, yeah, I'm not happy with them, and they need to change how they do business, or they just need to go out of business, because they're obviously in the wrong career choices if that is how they run a healthcare facility. Anyway, if you enjoyed this, please give me a thumbs up and subscribe. But like I said, I don't really do videos like this. I like to keep things happy, positive, that sort of thing. So anyway, I will be back at some point with I'm going to do some skin stuff, like skin blogs and like skincare blogs, and then some makeup stuff, because I have some amazing new things to show you guys. I know I look like hell warmed over right now, especially with these giant bags, where I've not been sleeping real good for a couple of days, and then I woke up this morning and this eye was really swollen, but it's going down the longer I'm awake, plus I've had some ice on it. Anyway, I hope everybody's having a fantastic day, and I will talk to you later. Bye.